Now we're going to first perform the injection. So we're going to actually bring the rotator cuff muscle, the main one called the supraspinatus, into focus. And the way that we do this is to have the patient rotate the arm back. And then it exposes the muscles of the supraspinatus right here. And we're just going to take a technique and we're going to get the entire tendon insertion here. And this is one of the reasons also why, again, just treating with ultrasound may not be proper, because you just treat into one defect, but the ultrasound's not going to reveal every defect that's in the shoulder. So I think that you're missing a lot of the fibers, and you can get an effective treatment this way. Interestingly enough, studies have shown for treatment of the shoulder that there is really no difference between using ultrasound and not using ultrasound. So science really helps to guide us and what we should do in our medical practice, when the treatment with the ultrasound is very cumbersome and isn't really adding to improved accuracy in an injection. And again, this is proved by science. But I strongly believe that if you don't learn how to palpate someone, you're going to miss many of the areas that need to be treated. And often you will miss them because you're relying on a diagnostic test rather than relying on your skill of physical examination. So here we are injecting the bicep tendon, which is a very commonly injured area, along with the rotator cuff. Often does not show up on imaging, but very, very common. And we want to get the insertion of it and follow that tendon up. The biceps, it's called biceps, meaning two, because there's two portions of the bicep. And here we're going to move the arm out, and we're going to get the inferior glenohumeral ligament as well. And this helps to keep the arm, or the humerus, in the proper position in the socket. So that was the treatment of the anterior or front portion of the shoulder. And now we're going to show the posterior, or the back portion of the shoulder. And again, comprehensive treatment based upon physical examination in my treatment guidelines always trumps treatment that's very localized under ultrasound alone. And you can see when we hit some of these areas, we get a little bit of a spasm. And typically you get those spasms when you're hitting an area of damage. It's very common that we kind of bring them out, even though diagnostic tests may miss treatment in this area. Again, if you go into the patient very quickly, you kind of distract the patient a little bit using your fingers. The actual needle injection itself is really not felt. And this is why you really don't need to put anesthesia on the skin, because you can go right through the patient's skin if you do so quickly, and the patient will hardly feel the needle. And here we can give a treatment also into the levator scapular tendon. And that was our treatment in the posterior portion of the rotator cuff.